I'm Professor Ruby Pawankar, head of the Division of Allergy, Department of Pediatrics at the Nippon Medical School in Tokyo, Japan. I'm currently the president of the Asia Pacific Allergy, Asthma and Clinical Immunology Association. I have been the president of the World Allergy Organization from 2012 to 2013. Well, the microbiome is the human body has more microbiomes or microbiota than the cells. Most people are not aware of it, but when we talk about bacteria, we talk about the bad bacteria. But the human body has these microbiomes which actually are healthy, and in the first 3 years of life, it's the balance or the symbiosis of this microbiome that actually maintains a good immune system. Any disbalance or imbalance, what we call as dysbiosis in this microbiome, that can result from various factors like excess use of antibiotics or the nutritional changes or other environmental impacts. These kind of things can alter the microbiome and then program you towards some of these chronic diseases like obesity or allergies or cancer. So that programming for chronic diseases occurs early in life, and when we look at what the awareness was on microbiome in 10 years back, there was so little knowledge, but in the last 10 years, especially last 5 years, there's so much more information that has come in that clearly shows that the microbiome plays a key role in disease development and probably in disease prevention when the dysbiosis is brought back into harmony. Well, there's a lot of research going on the microbiome. For example, looking at the microbiome in early life in the gut. We ourselves are doing a birth cohort from 0 to 3 years. People are looking at the microbiome in the respiratory tract. People are looking at the microbiome in the skin. And all these different studies are lending us more evidence to show that there is a link between the alteration in the microbiome. And when a particular microbiome is altered, what is looked at is how can we actually bring back that altered or the lack of that good microbiota through some intervention. So if we can bring back that or reduced microbiota to a balanced situation, that could probably prevent or alter the disease. Yes, there's a lot of work going on in the industry to researching on probiotics or prebiotics in their role in actually interventions. So this is what I was just saying, and symbiotics too. Basically, when we have the evidence to show that this particular microbiota is reduced and there is an imbalance there, how can we bring back that balance through a particular intervention of a particular type of probiotic? There are several probiotics or prebiotics, but there's strain specific. So the strain specific probiotic or prebiotic, for example, in case of allergies, certain probiotics have been proven to actually prevent the eczema, but they have no effect on asthma or rhinitis, but they can prevent eczema. Similarly, other probiotics or prebiotics are being looked at for diabetes or cancer. And so the market is actually quite exciting to see what is coming out in the future, and also the symbiotics, which is like a combination of these. Well, 5 years from now, I think there will be more evidence because there's a lot of studies. There are consortia going on. In US, there's consortia also looking at the role of the microbiome in disease development, and lots of clinical trials are being conducted on probiotics and prebiotics. So in 5 years, we hope that there would be some available treatments that can at least prevent the development of certain of these diseases, at least in my case allergies, in those who are high risk, because they have the family history of allergies. So at high risk, can by giving them early in life how we can prevent the development or the manifestation of the disease. Thank you very much.